Hi, welcome back to our daily blog about the building of a medical spa and wellness center. Many people ask me how I ended up in this area of entrepreneurial business. My formal training and my current medical practice is as a vascular surgeon. And a vascular surgeon deals with blood vessels, your veins, your arteries. I think it's somewhat instructive for me to give you an idea of the type of work that a vascular surgeon does. Many of the operations that I do are complex and in some cases life-saving operations. And most of the diseases that lead to a need for these operations are preventable diseases. Diabetes, hypertension, coronary artery disease that causes heart attacks, carotid artery stenosis, which causes people to have strokes, all the ravages of diabetes that can cause renal failure, failure of your kidneys. Many of these problems are preventable. We know that in some people there is a genetic predisposition to these risk factors. However, in the large majority of people, these are preventable diseases that occur mainly due to obesity and its related complications. Most of these problems are related to obesity and its related complications. Obesity at this point in America affects about 30% of our population. 60% of our population are overweight. But hopefully this will give you a little idea at how I arrived to this point in my life, recognizing the tremendous benefits of changing our behavior and our lifestyle and living a healthier, wellness-filled life. Philadelphia from my office. Not a bad view. My team prepares to place a shunt on this patient for kidney failure as a result of diabetes and hypertension over a long period of time. These are the tools needed for a basic vascular operation. A number of instruments are required to dissect the blood vessel and then to identify the blood vessel. Here we switch to the cardiac catheterization laboratory, where we intervene upon blood vessels by puncturing the blood vessel at a remote site, placing a catheter into the blood vessel, and performing procedures such as angioplasty and stenting. Here you see the abdominal aorta. And these are some of the common tools of the trade: a puncture needle to access the blood vessel, a catheter which would be threaded into the blood vessel to take pictures and also to access different areas, and finally a wire to allow us to pass into a blood vessel. Ready?
I'm taking.
Okay. So this is a stent used for angioplasty and stenting. It's a small catheter. This is going to go into the blood vessel. After we treat the blood vessel with the balloon to dilate it up, we'll place this stent, which will maintain the lumen of the blood vessel at a normal diameter. It's a small metallic piece. You can see it's very narrow, kind of a long sheath, passes into the blood vessel.